Hi, my name's Dr. Sridatta and I'm a consultant obstetrician and gynaecologist in London. I'm also an ambassador for the British Medical Association Research Foundation. Over the next few minutes, I'd like to talk about the human papillomavirus, HPV for short, and the HPV vaccination. So firstly, what is HPV? Well, the human papillomavirus, as the name suggests, is an infection and it's sexually transmitted. It tends to affect younger women, so an age group between the age of 20 to 30 overall. And there are over 100 different strands or subtypes. The most common strands that we're interested in are HPV strand 16 and 18. And we're interested in them because they are linked to virtually all cases of cervical cancer. So apart from the human papillomavirus, what else can affect your risk of cervical cancer? Well, smoking is a key factor. So if you do smoke, it is worth thinking about reducing or stopping. Other factors include whether you're on any hormonal contraception and of course if you have any significant medical problems. And these are the kind of questions that your doctor will ask you in more detail. So what about the HPV vaccination itself? Well, believe it or not, the vaccination programme is now 10 years old and it's given to girls aged between 12 to 13 in school. That's the most effective time to give it. It's given by 2 injections over the course of a year or 2. Now that's not to say that if you're older than 12 or 13 you can't have the vaccination, but it does mean a full course involves 3 injections. At the moment, the vaccination covers girls only, and in the NHS, the vaccination covers 4 different strands of the human papillomavirus, HPV. The key strands it protects against are infection by HPV 16 and 18. What that means is that although it's really effective at preventing infection with HPV 16 and 18, it doesn't necessarily protect you from all the different subtypes of HPV infection. What exactly are the side effects of taking the HPV vaccination? Well, as you can imagine, there can be some soreness at the site of the injection and you may feel unwell. And if these are the cases, it's always worth going to your GP. Make sure that you're happy with any potential side effect before you agree to taking the vaccine. But what about if you've been diagnosed already to have HPV, for example, at your first smear? Can you have the vaccination then? Well, unfortunately, once you have the infection, the vaccination can't protect you against it. But it's really important to remember that the vast majority of women will clear the virus within 18 to 24 months, so within about 2 years. It's worth making sure that you're completely clear of the virus by having regular smear tests. Once you are clear of the virus, then actually, yes, you can consider the vaccination, but remember, it may be less effective than if you were taking it as a teenager and if you hadn't already been infected by the human papillomavirus. You might ask, what about your partner? Why isn't he being vaccinated? Well, the reason is we haven't found the evidence in the UK that this would be beneficial overall, but HPV vaccination in some countries is given to boys as well as girls. So one thing to remember about the HPV vaccine is that it only protects against 4 key strands of HPV. So it doesn't necessarily protect you from ever getting any of the other strands of HPV infection. And remember, as you get older, the risk of infection gradually slows down and becomes less. So just to recap, today we've looked at the human papillomavirus and the HPV vaccination. My name's Dr. Sridatta and I hope this has been helpful.